The Gauteng Health Department's financial report for 2022-2023 has yet again attracted attention after details of irregular expenditure were tabled in the Gauteng legislature last week. The report was brought up as a response to questions asked by DA member of the provincial legislature, Jack Bloom, revealing that the department failed to spend 2.7 billion rand of its budget. 2.2 billion rand has been spent on irregular expenditure, with 15 million rand accounted for as fruitless and wasteful expenditure. We're now joined by the Gauteng Health Acting Chief Financial Officer, Masibolekwe Ndima. It's good to have you. Thank you very, very much for joining us on the program.
Good morning.
So, Mr. Ndima, the report which covers the period from the 1st of April 2022 to March this year, it received a lot of attention for the I suppose, scathing report that was given by the Auditor General. What is your response to all the criticism that has been levelled now against the Gauteng Health Department?
I think my response is very simple. First of all, let's admit where there are things that are really matters of irregularities and some anomalies. But what is important is that in the last 8 to 9 months, we have done quite well in terms of improving the control environment, the consequence management, and also those that are actually part of those irregularities. Some of them are undergoing through disciplinary, some of them have left the department. So in that particular culture, we are starting to see quite a number of improvement, even in the ethical behavior, because health has or used to be known of actually doing wrong things, but there's quite a lot of improvement in terms of the control environment, including the payment of service providers, which are paid weekly, twice a week, which is something that has never happened in history.
So you talk about consequence management. Anybody behind bars? Anybody that's been taken to task for the list of issues that are plaguing the Gauteng Health Department?
Prior to bars, there should be a disciplinary process that should kick in, it is now currently ongoing on some of the matters. And some of the matters, especially that the ones that have been highlighted by SIU is concluding on its investigation. But as a department, we didn't wait for SIU to complete its its investigations. But what we have done is that we have then seen where people have been pointed out by that report. We started what we call disciplinary actions. People were suspended. We even take it a step further, where we have seen a number of companies that have been highlighted by Peter, may his soul rest in peace. Those people and the companies that were involved, they were taken a step further, where we ensured that the department does not trade with those companies up until the entire investigation is completed. So there's been quite a number of things that we've been doing, but as you all know and you are aware, Leon, is that before anyone goes to behind bars, these processes must take place, and then that person then can go to bars. But as we all know, that the arm of the law is long enough, and that will happen.
Yeah, I don't think it's good enough. I don't. I mean, the reality is, it is in a dire situation. You look at an example like Tembisa Hospital that is still being plagued by so many issues, even after the death of Babita Diakarum. There are still people that claim, and this is just a report that I'm reading, I think it was from the City Press a few days ago, that they are being dismissed because they are speaking out about the maladministration that's taking place. And yet those that are doing it seem to be protected. So as much as you say that things may be changing, from what we're seeing, it certainly doesn't look like that. And it certainly doesn't look like it from what the Auditor General is saying, because everything that gets reported happens again And then, of course, you say things are turning around now. That's out of the reporting period. And we wait again for the Auditor General to bring the most recent one that'll be happening next year. But it never seems to get any better. In fact, it always seems to be getting worse. And this is from insiders speaking about what is going on inside Gauteng hospitals.
No, I tend to disagree with that, but there's only one thing I can agree with you, is the fact that the General's report is on historical cost basis. That I will agree with you. That's why I was saying to you that one of the things that we do is that I think I'm running out of pictures, sorry. One of the things that has happened is that if you would go to Tembisa Hospital and actually confirm what you're saying, you would be shocked what you would see there. The management, the staff, there's quite a lot of changes that has been made. And through our management and monthly budget management, we are seeing improvement to Tembisa Hospital. However, some of the things are institutional legacy. That is why where it has been associated with individuals in terms of a certain ethical behavior, that person has to go. And there is no such to say that people are dismissed in the institution due to the fact that they are seeking out on corruption, that there is no such earlier.
What about the fact of non-payment? I mean, we've just come out of perhaps you can update us. I mean, there was a point where Baragwanath had no food, that they couldn't feed patients because there's no money, and yet you have a budget of 60 billion rand. What happens to this money? Why are we not feeding patients?
No, patients are fed. And in fact, we have never had a situation whereby we can confirm, say, people are not fed. However, what we had in January was the issue of certain part of food that were not there due to the fact that the service provider that was there had issues of capacity. And that person has since been gone, and we are participating in other contracts in ensuring that no patients that comes to hospital and then they don't get meals.
Mr. Ndima, you were the CFO. You were the CFO at the time at Baragwanath when this happened. There was 4 billion rand that was outstanding on bills at Baragwanath. You can't deny that this happened. This did happen because service providers would not provide the hospital anymore because they're not being paid.
Leon, I'll just be specific. It's just that we can't name people here. I'll be very specific. When it comes to that, we had one service provider that had more than 78 items on food, which was a contractual problem. And we have taken measures to ensure that that service provider is assisted at the time, whereby we participated to contracts, Limpopo contracts, where they have over 100 service providers. And the issue around the payment had to do with tax clearance of that particular service provider. She was not in a good standing or compliant with tax clearance, and that's why we could not effect payments. Because treasury regulations are not allowing us to pay with people that are not non-compliant.
I understand, but the reality is that with a budget, and I go back to the issue that there is a budget, there's a massive budget, and then we talk about the reports coming out of 2.7 billion rand that is failed to be spent. That doesn't make any sense whatsoever when people need these facilities, where you see babies in cardboard boxes, you see, whether you're denying it or not, and you're talking about service providers and all of these things, the reality is that charity organizations had to step in to feed those that were at the hospital. That is what happened. So we're not going to spend the whole interview talking about this, but there is wasteful, reckless expenditure and corruption happening at the highest level, where South Africans are meant to be benefiting from a healthcare system that has a budget that countries would love to have the amount in, and yet it is reckless, and citizens feel they can do nothing about this. You say it's being corrected. Can you give us evidence that it's being corrected? Give me an example of a hospital that has turned itself around, that is doing so well.
Okay, there's quite many, Leanne, and you must pay a visit on this hospital. You can go to Edenvale, you can go to Polusong, you can go to Mamelodi. There's quite a lot. Now, let me go back to the issue of the 2.7 billion rand. And there's something that is called NTSG, where the budget is actually earmarked for a certain project. So let's not confuse the earmarked budget and with the equitable share or compensation. So this budget was mainly for occupational health and safety. Now, what has taken place is that with our implementing agents, there was a contractual dispute whereby an award was more than 2.7 billion. And what we saw fit was to say, look, we can't go on with that because we'll be creating a block hole of over 4 billion. And now I would be having an interview with you to say, but how come you exacerbated the budget to go to over 4 billion? So the decision was that we can't go with this contract. However, we'll then apply with a national treasure for a rollover of this money so that we can ensure that we don't attract an additional 4 billion rand irregular expenditure, right? And this has nothing to do with food and other things. It was an earmarked budget specifically for occupational health and safety, which is we have successfully been granted a rollover, although it's not the exact figure. And what we have taken measures is that we've then asked the National to assist with one of their implementing agencies, which is IDT DPSA, to assist us to ensure that actually using this money and these refurbishment projects are taking place on time, and we are managing that monthly.
Yeah. I'm going to ask you one final question, and I think it's probably a basic question. Do you use the public healthcare system in Gauteng, or do you utilize the private hospitals?
It's a personal question.
It is a personal question, but it's a question that I think would be. I think it's an important question, because if you think that the hospitals are doing well and are turning around, I think that is a question that one should ask. Because if you use it, then we've got a vote of confidence in it.
Okay, you can go and check my medical records as to where I have done, whether it's a flu vaccine or when I'm sick. Last week, I had tonsillitis. I went to Para. So I use the public health facility. We can't go away that there are shortcomings in this space. But what we're doing is that we have noticed, and some of these things are sort of institutional memory, some people's legacies, some are man-made, created by people. So that is why we came so strong in terms of the controls and to improve the control environment and ethical behavior. And we have also noticed that one of the problems that we have, issues that are related with contract management. That is why we have cleared and ensure that every participation or contract that we have actually has to be a valid contract. And that is why, and I would repeat this, we pay service providers twice a week. Yeah. And we are the only department that does that, because we believe that we don't have to hold you if you have delivered food or water in a hospital. If you deliver today, so enough, if you put your invoice in the next few days, you should be paid. Yeah. And we are proud about that. Yeah. And we are seeing improvement.
Yeah, well, listen, we'll wait and see. I suppose the president hasn't also got much confidence when he has basically allowed the SIU to delve deeper into the Gauteng Department of Health as well as Tembisa Hospital. So maybe more will come out of it. And when we talk again, that we'll have better results to work on, because I'm speaking at the numbers and I'm speaking at the lived experience of so many people that live in this province that feel they do not get that 60 billion rand worth of health care that they deserve. And that unfortunately is the long and short of it. But I will have to leave it there, unfortunately. I thank you for your time. The Gauteng Health Acting Chief Financial Officer, Masibolekwe Ndima, talking to us about the financial report for 2022-2023, which revealed that the department failed to spend 2.7 billion rand of its budget, 2.2 billion spent on irregular expenditure, and 15 million accounted for as fruitless and wasteful expenditure.